Good morning, everybody. 7 o'clock here in the UK. Very welcome to spend your breakfast with us here at Sky News this morning. Woefully negligent and taken your foot off the brake. Perhaps not the headlines the Health Secretary would have hoped for this morning after announcing he's no intention of triggering Plan B COVID restrictions right now. But does that promise hinge on more of us getting our boosters? We'll ask the Health Minister, Ed Argar, on the show shortly. Plus, we'll get the view of a clinical nurse with more than 3 decades of experience to see if she agrees with Sajid Javid that the pressure on the NHS is manageable for now. Also this morning, the former Prime Minister Tony Blair warning of a 4th wave and calling for 500,000 boosters a day. We'll speak to him just after 9 o'clock on the programme. And a slippery slope. Could a COVID-fuelled winter cause Europe's ski industry to wobble once more? 8:30. We're going to be speaking to an instructor about her hopes and fears for the season. Plus, the Telegraph's travel editor Claire Irvin will tell us how rising cases could impact your winter getaway. It's Thursday, the 21st of October. Willfully negligent, doctors hit out at ministers for not stepping up their COVID measures as the government tells people to get their boosters so we don't risk going backwards.
I'm in Oxfordshire to find out if British farmers think a trade deal with New Zealand is a raw deal for them.
A service this morning to mark the centenary of Northern Ireland's foundation. But Her Majesty won't be there after being advised to rest. We're there live.
I'm at a food bank in East London as a new study reveals that the number of low-income households in debt has tripled since the pandemic began.
9 months after he was silenced online, Donald Trump launches his own social media platform called Truth Social to take on big tech, he says. We report exclusively on how banks are investing in and loaning to businesses linked to deforestation. And intense streams of lava continue to shoot from the La Palma volcano, an eruption that's destroyed thousands of homes and forced several thousand people from their homes on the Canary Island. And off to a bad art. Celebrations as the world's first ultra-realistic robot artist is freed after Egyptian customs officers arrested her, thinking she was a spy. Well, it is Thursday. Doctors have accused the government of being willfully negligent for not triggering their Plan B COVID restrictions now to slow the spread of COVID-19. The Health Secretary, Sajid Javid, has warned we could see 100,000 cases a day. And on the slow uptake of booster jabs, he called on people to get on to avoid us all, to get one, I should say, to avoid us all going backwards. Emma Birchley reports.
For 19 months, Kimi Soko has hidden herself away, terrified of catching COVID. She's chronically ill with various conditions that have weakened her immune system. And while for many life is returning to some kind of normality, that certainly isn't the case for her.
There's compassion fatigue. So the numbers aren't getting us as riled up emotionally to where we feel the civic duty to do our part as they did in the beginning. It's frustrating because some people's livelihood hinges on your adherence to common decency.
But the number of cases has been rising for over a month, and there are warnings that the health service could be heading for the most challenging winter on record.
I represent doctors, and what they're telling me, especially those in hospital, is that the pressures are really building up. We're seeing ambulances now queuing outside A&E, and it's not even the height of winter. So I'm not really sure what more we need to watch and wait for. Now is the time to put in place measures to reduce the spread of infection.
Increasingly, the onus is being put on us as individuals to do the right thing, with the Business Secretary and Chief Medical Officer among senior figures pushing a message of personal responsibility. But the fact is, since mid-July, there's been no legal requirement, in England at least, to wear a mask at all.
If it's a legal thing, then people will be afraid of the penalties and other things they will start wearing again.
How do you enforce people wearing masks on trains? or on buses? How can you enforce that?
You'd have to have a law. I would obey the law, but I would think a lot of people wouldn't obey it. Not now. They've had enough of lockdowns and wearing masks.
But elsewhere in the UK, mandatory mask wearing has never gone away. And in Scotland, where the case rate is lower, they're still worn in schools.
We've also had massively delayed vaccination of adolescents and very poor rollout compared to, say, Scotland. So, for example, we have about 15% of 12 to 15-year-olds who've been vaccinated compared to about 50% in Scotland.
The message the government keeps pushing is get vaccinated, and when offered, book your booster. But with the colder weather looming, it seems less and less likely that that will be enough. Emma Birchley, Sky News.
Joining us now, Health Minister Edward Argar. Hello to you. Thanks
Morning,
for joining us on the programme this morning. COVID deaths rising 21% in a week, but no plan B yet. Why not?
Well, we continue, as you would expect, to look at all the data, a range of factors. And as the Health Secretary made clear yesterday, the NHS, while under huge pressure at the moment, and I pay tribute to all those working in it, it is a sustainable pressure at the moment. And the key thing, the key factor, which I suspect you may come to a little bit later, is what's the difference between now and, for example, last time, which was, I think, back end of last year, end of December, beginning of January, when we saw these high levels of infection rates, is, of course, the vaccine programme, which, while not completely breaking, has hugely weakened the link between infections and hospitalisations and sadly, deaths.
I wasn't going to ask you that. In fact, I was, going to ask you about Sir Patrick Vallance, the Chief Scientific Advisor, who said, act when you think you don't need to. So that, if you interpret that, that would be act now because you don't think you need to.
Well, no, I think what Patrick's saying there is you've got to look ahead at what this disease does. We know that you have a lead time of 2 weeks, roughly, between infections and hospitalisations, and a further 2 weeks between, sadly, hospitalisations and deaths in the most serious cases. But the key change there has been the vaccination programme, which has altered the dynamics since I first started talking to you about this a year and a half ago, I think.
But so what Patrick's saying... 21% a week, 21% in a week.
Well, let me just answer the Patrick point a little bit, and then I'll come back to your point there, if I may. I think what Patrick's saying is always look to the future, consider when is the right moment to act and do it before it's forced. I don't think we're at that point yet, but we will continue to review it carefully. Now, on the deaths point that you raised, yes, sadly, we are seeing hospitalisations and deaths going up. That's a reflection of the big number of infections. But if you just take a data point a few days ago, I think about the 15th is the data off the top of my head, where we had about 450 infections per 100,000 in our population. And you saw about 700 people, I think, admitted to hospital on that day, and sadly just shy of 100 deaths. If you then look at when we last had that level of infections, which is about the back end of last year, you were talking about 3,000 people being admitted to hospital and considerably more deaths, around 600 deaths. So that's the difference. I use that. It's not a perfect analogy, but it's an illustration of why the infection rate is relevant, but it's not. It doesn't pull through into those deaths and hospitalisations in the same way.
Well, let me ask you this then. How bad does it have to get?
Well, I think what you're asking there, I can entirely understand where you asked the question, but it's not. It wouldn't be appropriate to set an arbitrary figure, X number of infections, X number of hospitalisations. We need to look at all this in the round. We need to look at the death rate, absolutely. We need to look at that booster rollout programme, the vaccination programme. Vaccination rates in young people, the 12 to 15-year-olds, because we're seeing in that school-age population, that's where we're seeing actually the biggest increases driving these infections. So it's not, sadly, and I can entirely understand why you'd like a simple, clear-cut answer. Sadly, it's not as...
for my benefit,
and for your viewers, of course.
Home who
but
is saying,
sadly,
how bad does it have to get?
And you know that I always do try to answer your questions.
I do,
clearly,
and that's why I'm asking you again.
But on that one, I can't give you a simple, here is a sort of black and white answer, here's a binary line, because there's a whole range of factors we'll take into consideration.
But you did say there is a point to act, but you don't think that is yet. So when is that point?
Well, it depends, as I say, on a whole range of factors. But the reason I say not yet, and why the Secretary of State, Sajid Javid, said that yesterday, is because we are seeing pressure in our hospitals. We've got a challenging winter coming. We see that every winter. If we didn't have a COVID pandemic, I suspect you'd have me on normally to talk about winter pressures in the NHS and flu. Now, we see that coming with COVID, with flu, and a resurgence of flu and other seasonal infections. So we are seeing pressure in the system, but we're not seeing unsustainable pressure at the moment. So if you take hospital beds, just as an example, we've probably got at the moment around 95,000 hospital beds in our system, smaller than it has been because of infection and prevention measures. about 7,000 or so of those are occupied by COVID patients, but we've still got around 6,000 that are currently unoccupied. Now, they're unevenly distributed, but we have got that capacity. So at the moment, we're saying the NHS is coping with a difficult situation, but we need to look carefully at all those, and that's one of the factors I'll be looking at.
We know how quickly that can change, and we had the head of the NHS Confederation on yesterday. He said, is the government absolutely barking mad? You need to get ahead of this, and, you know, by not implementing Plan B, you're not getting ahead of it.
Well, I know Matthew well. I've worked with him since he's taken up that role, and I have a lot of respect for him. Personally,
there's a but coming.
I disagree with him on that particular point. It's a timing point. You know, what is the right time? What's the right time? Matthew saying we should have done it yesterday. Others will be saying you don't need to do it for a long time. And that's why this is a difficult judgment with multiple factors, as you'll appreciate.
Let's talk about boosters instead. Why are people not getting their boosters?
So there's a mixture of factors here. Firstly, there are around 5 million people who are entitled to jabs who haven't had the first or second jab. My message to them, get your jabs. You're eligible, you're entitled, please do it. It's the single biggest thing, as Sajid said yesterday, that will avoid that pressure becoming unsustainable. It will avoid the need for any further restrictions. But to your point about boosters, we've delivered about 4 million. There are, I think, just over 2 million more invitations or around 2 million more invitations that are going out as we speak to people to do it. So we've got the capacity in the system. We've got the vaccine. We've got, I think, over 2,500 venues where people can be jabbed across the country at the moment. Part of it is encouraging people to take up that jab. And I think going to something I think you raised on your programme yesterday morning, and we've made a change, which is it's not just about waiting to be invited. If you get to the 6 months plus 1 week, go on the national booking system and book yourself in. But there's also the other factor, which is a slight, which does delay, not delay, but phases the rollout, which is the JCVI's current advice, which is don't have your booster until 6 months afterwards. So if you look back 6 months, that's that cohort is starting to come through now. Is there a slight lag? Yes, there is, and that's why we have taken the step we have. Say,
how do you book online?
Book online.
What do you
go on the? Well, you can go on the ring 111. Or you can go on the NHS website. I booked my jabs when I was eligible some months ago. For the first time, you go in, you log in your details, your NHS details, shows you're eligible, and then it shows the venues and you can book into.
So it's very straightforward. You don't need to go to see your doctor. You can do it at a jab vaccine centre.
If you get to that 6 months plus 1 week, so until that point, wait to be invited. But if you get that and you get a week beyond it to allow for a little lag, and I think this was a point you raised with Kwasi yesterday, but.
Have we changed policy here at Sky News for you?
I don't think it's about changing policy. Throughout this pandemic, you've seen we've sought to be, and I've tried to be pragmatic, and where on your show, on others, people have, your viewers and others highlight saying, well, this bit doesn't quite work for us, or
so
it could be made. We look at it and we'll see if we can do something that makes it easier for people.
Glad to hear it. You're presently jabbing, looked at the figures for the boosters over the last couple of days, about 200,000 people a day. Tony Blair, former Prime Minister, saying that needs to be at 500,000 a day. Are you going to be able to reach that target?
Well, I sincerely hope so. We've got the capacity to do it. We've got the people to do it. We've got the jabs to do it.
Though, have you?
We've got the jabs, and exactly that. So that's why you know, I'm here to answer your questions. I'm also here slightly to sort of exhort people. If you get the call, if you're invited, please do it, because that is the best way not only of protecting yourself and your friends and family further, but also of easing that pressure and allowing us to keep going as normal or as normal as we can.
And if you don't, you know, was the underlying comment from the Health Secretary yesterday, other measures will have to come in place. I'm reading in the Telegraph this morning, there could, apart from being a Plan B, there could be a Plan C, no mixing of households at Christmas time.
Well, I have to say I saw that story on my way over this morning. That's not something I'm aware of. I checked it out and I'm told there isn't. That is not a story with foundation. Of course, as a government, you look at, as we've done with our Plan B, alternatives and ways that you might, if you needed to start easing that pressure. But the specifics of that and what was mooted in it, as I understand it, because I only glanced at it, I'm afraid, on my way in this morning about sort of limiting household mixing and things like that, in a sense, going back, is that it isn't something that is being actively considered.
My viewers, I would think, this morning would think, why did ministers keep coming on the show and saying that's definitely not going to happen and that's definitely not going to happen when you don't know what's going to happen?
Well, I think it is rare that I've ever been on your show and said something with a definite.
So is lockdown definitely going to happen or definitely not going to happen, lockdown?
And the reason I do that is because you will always, understandably, for your viewers, want to try and get, as we said at the beginning, a clear yes or no answer. And sadly, in this space, in a lot of these questions, that isn't possible. On lockdown, you asked that specifically. I'd come back to comments made by Kazi and others. There is no intention to reimpose lockdown. We did it last year, and one of the reasons we did it at the beginning of last year and during last year is because we didn't have the vaccine. And the latter lockdown we did, but it was still being rolled out in its very early stage. So we didn't have the vaccine. We didn't have in the early stages these treatments, remdesivir and the sort of new treatments we announced yesterday that we're buying in advance, which help avoid people going into hospital. So that's what's changed. But I come back to the key message. Please, everyone, please do get your jabs if you're invited.
Now, I was a bit cross this morning, Minister, I have to say, when I was reading about COVAX. And we have contributed to COVAX. Just looking at the figures, we promised to donate 80 million doses. We've delivered so far only 7% of that. And worse than that, we have taken 500,000 doses from COVAX, which is designed for countries that can't really afford them, third world countries, places like South Africa that have only had a 4 or 5% uptake. What are we doing taking vaccines from COVAX?
Well, there's 2 points there, Kate. Firstly, there is a little bit of a tension here we're seeing where, your question is quite legitimately saying, have you got the vaccines? Yes, we have, was the answer. But there's a tension there with a lot of people saying, make sure you get those boosters, make sure you've got what you need here. Equally, quite legitimately, people saying, well, we're not protected until everyone's protected, and that includes the poorest nations in the world, so quite rightly, we should be donating. Do we need to do more to drive that donation, drive the pledges we made and deliver on them? Yes, we do. But I'd also highlight in the context of COVAX, of course, we, as a country, were one of the countries that kick-started that with huge financial investment at the beginning. And we also, as a government, again, invested in the Oxford AZ vaccine up front and striking the deal that it should be delivered at cost price. So I'd entirely take your point that when we make a pledge, we do need to deliver on it and we need to keep making sure we focus on that. But equally, I would just highlight the work we have done, the money we've put in.
Is the fact that we took 500,000 doses. We were criticising the Canadians for taking 1 million doses. We have taken 500,000 doses from COVAX that should have been going to countries that need it more.
And we've put the financial resources into COVAX to get it going.
It's not acceptable to do that, though, is it, Mr.
I think there's always a balance to be struck here, and I suspect that in the case of how that worked, it will have been simply a matter at the time of, here's how the process works, if we're entitled to it, this is what's been done. You're absolutely right, though, we have a moral obligation to support all those around the world with these vaccines. We've done it in the development of the programme, we've done it in the investment in the AZ vaccine. And the reason we do that, and the reason, you're right, we need to deliver on our pledges in terms of donations to COVAX, and indeed more broadly our work through Gavi and other programmes, is because we're not completely protected, we're not completely safe, and no country is, until the world is protected. So I don't dispute your point about just how important this is and the moral obligation on us, and I think that's why we continue to focus.
Will we potentially take vaccines from COVAX again? Can you rule it out?
Well, my understanding is we have the supplies of vaccines we need, both, as I said to you, for our booster programme, for our young people, our 12 to 15-year-olds in our programme there. So I think our focus should be on getting those jabs in people's arms when those arms come forward, but also in parallel on getting additional jabs to
You're not
countries
ruling it out, then?
Through COVAX. I don't anticipate that being the case. I think my understanding is that is something that occurred historically. We've bought a huge number of vaccines, tribute to the Vaccines Task Force. We've got the vaccines we need to deliver.
How do you feel morally about doing that? About taking vaccines from people that needed them?
Well, what I'd come back to is the track record we have of investing in the vaccines to get it for those people.
Yeah,
and we are donating.
We're donating and then taking it back.
I suspect, Kay, what happened there, I'm not familiar with the exact detail of what happened. I think this is a story that's emerged this morning.
It has. I'm sure you'll be asked about it again, Minister,
and I suspect I will be. But the key point I would make on that is that I suspect, and I'll be honest with you in this, I suspect what will have happened is at the beginning of the pandemic, or when vaccines started becoming available, later on in the pandemic, I should say, there will have been a mechanism whereby there were allocations drawn down. I suspect that was probably just done automatically. I take your point. It's not something I would wish to see happen because I don't think we need to, because we've got our vaccine stock. So I would look to see us not doing that and supporting all those countries to the very best of our ability.
It's going to be a difficult day for you today, along with the family of James Brokenshire.
It is, and he was a regular on your programme, and so you'll know...
Fabulous man.
Exactly, you'll know, as do I, as a friend of his and all his colleagues, what a lovely man he was. But as we heard in the tributes yesterday in the chamber, he was a very nice and very decent man, but no one should ever mistake that for James being a pushover or too nice. He was an incredibly competent and effective minister. And so, it's his funeral today, and we're all thinking of him and Cathy and the family.
Our deepest condolences to the family,
Thank you.
if you
I'll
would.
pass that.
Thank you very much indeed for joining us. Thank you. And just a reminder, if you want to catch up on any of that interview or indeed watch the programme when you are out and about this morning, then of course you can. You can find us on the mobile app, or you can go to our website if you prefer and go into our live blog to watch the programme live. And you can also catch up on the interviews on my Twitter as well, and that is at Kay Burley. Still to come on the programme for you this morning. Most of us have been jabbed, but how well are they working? At 7:30, we'll discuss vaccines and booster doses with Professor of Immunology at Imperial College London, Professor Danny Altman. A new way to treat dementia at 7:45. We'll meet the scientists behind a study that used infrared light to help treat those suffering with the condition. 9:45 is buying a house about to get even harder. It looks like mortgage prices are on the rise. We'll ask a finance expert what on earth is going on. More on that breaking news from overnight. In the UK and New Zealand agreeing to a new trade deal aimed at eliminating tariffs as high as 10% on a wide range of goods. It's causing concern among some sheep farmers that they could now face increased competition from lamb imports. Our business correspondent Paul Kelso is joining us live from a sheep farm in Witney in Oxfordshire. Good morning to you, sun just rising behind you there. Paul, what's the view on this trade deal?
Yeah, morning, Kay. I'm at a farm in Northmoor in Oxfordshire where they farm sheep on pasture that can't really be used for anything else. They take a great deal of pride in turning out around 1,000 lambs a year here. Some of them they sell at the farm gate, others they sell through the supermarkets, and they are concerned. They believe this trade deal with New Zealand is effectively going to give the factory farming, or certainly the mass farming might of New Zealand, 12,000 miles away, the ability to undercut the produce they make here to what they say are the highest possible standards in the UK market. Now, this trade deal with New Zealand is the second the UK has struck since Brexit. It's significant following the deal with Australia announced earlier this year because it's been built from the ground up. It doesn't just roll over the terms of an old EU trade deal, and it's a sign, the government will say, of Britain's ability to strike these deals as an independent trading nation after Brexit. But nowhere in the British press release, which talks about some of the benefits to UK consumers, cutting tariffs on imported wine and honey, for example, British cars going in the other direction and not facing import taxes. Nowhere does it mention agriculture, and that might be because agriculture appears to be the trade-off that the British have allowed here in exchange for those cuts to New Zealand imports and for British people to be able to go and work in the services and professionals to work more easily in New Zealand. They've allowed access tariff-free over a 15-year period to New Zealand farmers. It's the same as the Australian trade, and that will be the criticism of this deal, that trade-off of British agriculture has been given away too cheaply. OK, thank you. Service of reflection and hope is being held at St Patrick's Church of Ireland Cathedral in County Armagh to mark the centenaries of partition of Ireland and formation of Northern Ireland. The Queen was expected to attend but has cancelled her trip after being advised to rest. Our senior Ireland correspondent, David Blevins, is in Armagh ahead of today's service. It was a surprise, David, that she isn't attending.
Yes, they are very disappointed here, as you would expect, Kay. A very good morning from Armagh. It is, to the best of my knowledge, the only city in the world with not one but two cathedrals of St Patrick, one Roman Catholic and the other Protestant. And it is here, to the Anglican Cathedral, that church leaders have come together to organise what they've described as a service of hope and reflection, marking 100 years since partition and the formation of Northern Ireland. And they're very disappointed that they've lost not just one but two heads of state from the congregation today. Her Majesty very reluctantly yesterday cancelling what would have been her first visit to Northern Ireland in 5 years on the advice of her doctors. The 95-year-old monarch will instead be resting at Windsor. But the Irish head of state, President Michael D. Higgins, had already declined his invitation on the basis that he didn't consider the wording of this event politically neutral. Now, the Irish Foreign Minister Simon Coveney will attend. We understand the British government will also be represented. I think it is worth just noting that it would be impossible to mark the formation of Northern Ireland without acknowledging that it only came into existence as a result of the partition of this island. But this comes at a difficult moment, bearing in mind that the fresh Brexit tensions over the border have placed a strain on Anglo-Irish relations.
OK, thank you. Thanks a lot, David. Donald Trump is launching a new social media platform to stand up to what he calls the tyranny of big tech. The former president, who was banned from Twitter and Facebook earlier this year after accusations he incited the 6th of January insurrection at the US Capitol, says he plans to share his thoughts with the world on Truth Social. Mr. Trump has also revealed that he's forming a new company called Trump Media and Technology Group to rival tech giants like Twitter and Facebook. In a statement, he said, "We live in a world where the Taliban has a huge presence on Twitter, yet your favourite American president has been silenced. This is unacceptable. I am excited to send out my first truth on Truth Social very soon." And the former US President Bill Clinton has said in a video on social media that he's glad to be back home 3 days after being released from hospital. Mr. Clinton was diagnosed with a urological infection which spread to his bloodstream and spent 5 days in intensive care. Mr. Clinton has urged people to keep a check of their physical health.
Take the time to listen to your bodies and care for yourselves. We all have work to do, and each of us has an important role to play in life and in the immediate future. I, for one, am going to do my best to be around to keep doing the most good I can for a lot longer.
Looks a bit poorly, doesn't he? Now, a large-scale study of households on low incomes has revealed the extent of the debt crisis impacting the UK's poorest families. The Joseph Rowntree Foundation estimates that the number of low-income households in debt has tripled since the pandemic began. Aisha is at a food bank for us in East London this morning. Hi, Aisha. Good morning. Tell us more about this report from the foundation.
Well, this research really just highlights another impact COVID-19 has had. The Joseph Rowntree Foundation were looking at the households in the bottom 40% of income in the UK, and out of 11.6 million households, 3.8 million in arrears. Like you said, that's triple the number when you look at figures from before the pandemic, and people largely behind in things like rent, council tax and gas and electricity bills. It's meant that places like this, the Felix Project, have been busier than ever over the course of 2020. They delivered more than 21 million meals out to the community in London. Now, if we take a look at some of the numbers from this study and look at those worst affected, the data shows that 55% of families with children have fallen into debt. The figure is the same for households in London, but analysis shows that those from Black, Asian and ethnically diverse communities have been hit the hardest, with 58% in arrears. Campaign groups are saying that financial pressures for these households aren't abating and that the situation could get much worse very quickly. But the government said that things like the plan for jobs will help upskill workers and provide opportunity for people to get into well-paid work. And in the meantime, there's also things like the Household Support Fund available for those most vulnerable, and universal credit supporting millions.
OK, thank you. The study estimates 55% of families with children have fallen into debt, as we were hearing there from Aisha. And as a result of that, Aisha will be inside that food bank for us a little bit later on today. Now, she could very well be the future of art as we know it, but the world's first ultra-realistic robot artist has hit a snag ahead of her latest show. This is Ada. who's named after mother of computing science Ada Lovelace, and she's due to open her latest exhibition at the Great Pyramid of Giza. But when she arrived in Egypt, she and the sculpture she created were held by customs officials. They said the modem, that she uses and the cameras in her eyes could pose a security risk. Luckily, Ada was freed yesterday after 10 days, a few hours before the exhibition was due to start. Hopefully, she'll be able to paintbrush the whole experience off. See what we did there? Ha ha. Still to come, striking scenes from La Palma as its volcano continues to spew lava at an alarming rate with no sign of an end. There you go. The eruption that began more than 4 weeks ago has forced the evacuation of more than 6,000 residents and destroyed thousands of homes on the Canary Island. An expert yesterday warned that an end is difficult to predict, as it's more intense than previous eruptions, the last one back in 1971. At the same time, here's the exact moment Japan's Mount Aso erupted yesterday morning, releasing smoke and debris more than 2 miles into the sky. Their meteorological society says there were no signs of injury or damage, but warned citizens to stay away for fear of a second eruption. Pretty dramatic stuff, wasn't it? Now, as COVID cases surge, we'll ask an expert how long the vaccine is effective for and the role boosters can play. All of that to come. Again, everybody, doctors have accused the government of being willfully negligent for not immediately triggering their Plan B COVID restrictions to slow the spread of COVID-19. That's as cases continue to surge. But the Health Minister, Edward Argar, has told us this morning that for the time being, the pressure on the NHS is sustainable.
The reason I say not yet, and why the Secretary of State, Sajid Javid, said that yesterday, is because we are seeing pressure in our hospitals. We've got a challenging winter coming. We see that every winter. If we didn't have a COVID pandemic, I suspect you'd have me on normally to talk about winter pressures in the NHS and flu. Now, we see that coming with COVID, with flu and a resurgence of flu and other seasonal infections. So we are seeing pressure in the system, but we're not seeing unsustainable pressure.
Tamara's here. Good morning, Tamara. Don't panic, Mr. Mannering.
Yes, Plan A all the way is what the government are saying. They say that the pressure in the system is not unsustainable, despite the NHS leaders yesterday warning that it was, because although Mr Argar said there are 6,000 unoccupied beds in the NHS, of course, they may not be where you need them at the right time. So we're already seeing parts of the NHS, including the Doctors' Union, the BMA, saying it's willfully negligent of the government in England not to bring in more measures. The number 10 point out there, of course, a trade union, but still they are saying that we are at that point now. The government say we are not at that point now, although interestingly, Sajid Javid said yesterday, there was a very sombre tone, as he said, cases could reach 100,000. They don't think we'll be in remotely the same situation in terms of hospitalisations and deaths as we were at this time last year because of the vaccine. But he did say, look, be cautious, wear your mask. If you can mix outside, do. If you want to take your lateral flow test before you go to a gathering, do. So perhaps we're edging towards Plan B already without it actually being said. But as to the idea that there might be a Plan C beyond that with restrictions on indoor mixing, the Minister's firm answer was no, there isn't.
OK, tomorrow's take at 9 o'clock this morning. Looking forward to it. Thanks very much indeed. Well, the backdrop to the Health Secretary's winter warning was another 49,139 new coronavirus cases reported in the last 24 hours. A further 179 people have died, which takes the total within 28 days of a positive test to 139,031 deaths. Almost 43,000 more people have received their first dose of a vaccine. Just under 33,000 have had their second dose. That brings the total number of people who are now fully vaccinated to 45 million. And just over 199,000 booster vaccines were given in England in the last 24-hour period, taking the total number of doses to more than 4 million. Figures for other parts of the UK were not available. So 200,000 booster doses yesterday. We'll be speaking to the former Prime Minister, Tony Blair, who says we need to get that figure up to 500,000 a day if we are going to fend off more restrictions leading to Christmas. Joined by Danny Altman, an immunologist at the Imperial College London. Hello to you. Thanks for joining us on the programme this morning, Professor. No plan B as yet. How are you feeling about that?
I feel very worried. I don't mind whether it's termed A, B, C, or D. All I know is that the new slogan of living with the virus sits very uncomfortably with how we normally practice medicine and medical research in this country, because we normally don't tolerate avoidable deaths that would be easily avoidable with quite simple mitigations.
What is it about people not wanting their booster, do you think? Because slight blame game this morning from the Minister saying, we've got the jabs, we just need the arms to put them in.
Yeah, it's very hard for me to say where the real bottleneck is, whether it's people not coming forward or whether it's hard to access. I think it's probably a bit of both. I think we've done less well than some other countries in terms of getting boosters into people. All I can say, if there's anybody out there who has any doubts whatsoever, please just look at the data. So I'd point them, for example, to the publications from Israel, where they were troubled like us by a surge from Delta breakthrough cases. They had a massive program of nationwide boosters, and they crushed that curve. So let's just do it.
A lot of older people don't want the Pfizer booster. That's anecdotally from my experience when I was working in a hub. If they came and the vaccination that were being offered was Pfizer rather than the AstraZeneca, they didn't want it. They went away, some of them, and then came back when AstraZeneca was available. If you've had an AstraZeneca, you need to have a Pfizer, or you're advised to have a Pfizer as a booster. Just to explain, you know this, I'm just explaining it to the viewers. As a booster, then you're mixing up the two vaccines. So what are we going to do if older people don't want to have Pfizer?
Well, maybe we need to have that discussion, and all of this has been a work in progress, hasn't it? So there's quite a lot of fancy immunology that's being worked out, building the aeroplane as we fly. So there's a slight aversion to giving things like AstraZeneca adenoviruses over and over again because of the risk of building up antibodies that might actually block the functionality of that vaccine, thus the choice to go with Pfizer. But it is a work in progress.
And about these two antiviral drugs that we heard quite a lot about yesterday at the news conference in Downing Street, great step forward?
I think it's enormously exciting. These are the breakthroughs that we've waited for now for, 19, 20 months, because you look at the cell biology of a virus like this, and at the moment we've focused on one Achilles heel, haven't we? The binding of spike to ACE2 and hitting that with antibodies. But there are many other points where we can hit it, and we just waited for this moment. And this looks like a very big breakthrough.
How long are they effective for?
Yeah, again, a work in progress, isn't it? Because if you'd asked me this question, a year ago, I'd been fairly gung-ho and said most of us were probably good for 1 to 2 years. Then Delta comes along, and it's such a game changer and breaks through our defences. And it looks like people are becoming vulnerable after 6 months. So we have to be very fleet of foot to keep looking at the data and reappraising.
And other variants potentially on the horizon, especially if people starting to get involved with international travel again. Do you think we're going to be in a position where we have to have potentially a booster every year or maybe even every 6 months?
Hard to say. I really hope not. So we've all been watching the variants of concern coming around the curve. And I think many of us thought that Delta was kind of peak variant, and there weren't many more up the virus's sleeve in terms of changes it could make. Let's hope that the rate of new variants coming along is slowing down, and this might all settle out in due course. Let's hope.
What's your biggest worry, Professor?
Oh, my biggest worry is that we lose control, do this thing of learning to live with the virus instead of saying, no, these are people's lives, this is avoidable, there are simple measures here. Masks, ventilation, a bit of distancing. Let's just grapple with this and not be one of the countries where we cheapen the value of life and don't care about avoidable deaths as much as, say, mainland Europe. Let's do the job properly.
Sounds like a plan B to me.
Call it what you like.
What about children under the age or as young as 5 being vaccinated? Where are you on that?
I feel like we slightly fooled ourselves in this country by being with our pride in our great vaccine rollout, but we hadn't really rolled it out to all the people whose lungs this virus could live in. And so in terms of population immunity, that's a job only half done. I see no reason not to keep rolling out the vaccine through the age range, because as you well know, all the cases at the moment, or many cases, are overwhelmingly spreading out of school-age children. So let's just do the job properly.
OK, Professor, good to talk to you. Thanks for your expertise, as always. Well, those youngsters will soon be able to get a COVID-19 vaccine in the United States. 28 million jabs soon be rolled out at paediatricians' offices, local pharmacies, and potentially even at school as well. It comes as the New York Mayor, Bill de Blasio, declared all municipal workers must be vaccinated or risk being placed on unpaid leave. Joined now by a Professor of Infectious Diseases at the University of California, and that's Peter Ching Hong. Hello to you. Thank you for joining us on the programme. So 5-year-olds being vaccinated. Tell us more.
Well, Kay, the meeting is next Tuesday at the FDA, where they will review the data from Pfizer, showing that at 1/3 the dose, that is 10 micrograms, they get an equivalent immune response to older individuals ages 16 to 25. Fewer side effects, at least initially, and so it appears good to go. I think most people are behind this, including the American Academy of Pediatricians. There are already school mandates proposed for 1 year from now in California, and hopefully other states will follow.
Yeah, I mean, we often hear a lot here, the other side of the pond, about anti-vaxxers in the United States who think that it's barbaric to particularly vaccinate children.
Yeah, so there were protests a couple of days ago in California where there was a sit-out where school kids stayed at home on their parents' desires and protested in major cities in California, the mandate proposed for 1 year from now. But if you look at the data, only about 1/3 of parents actually vehemently oppose any vaccination of their kids aged 5 to 11. About 1/3 will say they'll go out immediately and vaccinate their kids, and about 40% will watch and wait.
Not the case in New York City, really, is it? Because the mayor there is saying to emergency workers that if you don't, blue light workers, I should say, if you don't have 2 vaccinations, you're on unpaid leave.
Yes, but we do know that vaccine mandates have been working in the US. Take, for example, the Los Angeles Unified School District. About a month ago, there were about maybe 60 to 70% of school staff and teachers vaccinated. The deadline was on Monday, and by Monday, there were 97% of the school staff and teachers vaccinated. So we do believe that the carrots only work to some regard. Lotteries, a shot for a shot, ice cream, donuts. At the end of the day, mandates have really moved the dial much more in the United States so far.
Goodness, I didn't even get a cup of tea when I had mine. Talk to me quickly before I let you go, Professor, if you would please, about those that say, you know what, rather than giving these jabs to kids, what the United States and other developed countries should be doing is shipping them off to South Africa.
I think the answer is yes and yes. I think we can be both doing increasing community immunity as well as sharing the recipe, having the raw materials to make the vaccines, and having the manpower and the technical know-how to spread the word. I think Merck is giving a good example for their oral antiviral medicine, molnupiravir. That's where they've shared the recipe with generic companies. They're having a tiered pricing system. So I think, all hands on deck. And you're right, we can't really defeat the virus until every one of us is vaccinated around the world.
OK, Professor, good to talk to you. Thanks for staying up for us in San Francisco this evening. Thank you.
You're welcome, Kay. Thank you.
Thank you. We're going to be talking about that in more detail to the former Prime Minister, Tony Blair. He's joining us in the 9 o'clock hour here on Sky News this morning. Now, some of the world's biggest banks are investing in businesses linked with deforestation. That's according to a new report shared with Sky News. Helen Ann Smith has this exclusive report.
Behind glassy facades in financial centres lie deals which determine the flow of money. But there are serious questions about where some of it goes and what some of it funds. A new investigation shared exclusively with Sky News shows that tens of billions of pounds is financing work like this. Banks and asset managers investing, underwriting and loaning to agribusiness linked to deforestation.
They tell us they're green institutions, but they just keep doing it.
The research team analysed 70,000 deals struck with 20 of the worst offending businesses. They say many banks profited to the tune of tens of millions of pounds.
They're very good at telling us how green they are, but what we found is this gaping hole between what they say in public and what they actually do. So when you follow the money and look at their revenue streams, look at their actions, you realise that they're not as clean as they say they are.
In fact, since the Paris Climate Agreement in 2016, financial institutions in Europe, the US and China have made deals worth £120 billion with firms linked to tropical deforestation. US bank JP Morgan was the biggest lender, making deals worth over £7 billion, while in the UK, HSBC was the biggest financer, making deals worth over £5 billion. HSBC alone made estimated proceeds of nearly £30 million from these deals. That's despite a pledge 4 years ago to stop financing firms accused of deforestation. In a statement, it said HSBC has exited, is in the process of exiting, or has no banking relationship related to forestry, palm oil or cattle, with the majority of entities named in the report. It says it's ended relationships with customers that don't comply with its policies and is committed to tackling deforestation. JP Morgan declined to comment. There's nothing illegal about these deals, but many banks have pledged not to make them. However, there's a growing argument that self-regulation hasn't worked, and what's needed is a change in the law. The government's flagship environment bill is due next week, a perfect opportunity according to some. Neil Parish tabled an amendment to ban these type of financial deals, but it was rejected.
The legislation is always important because you can then go to these major banks, major companies, and actually say you have acted illegally, you must stop, and we can take direct action.
But even despite all of that, the government rejected your amendment.
But that doesn't stop us still talking to government, and I think the government has come a long way in the Environment Bill towards the direction we want.
Cutting down forests not only contributes to climate change, but is devastating to local communities. Cutting off the finance would substantially cut down the practice. Helen Ann Smith, Sky News.
Did you know that if we make small changes to our lives, we can reduce air pollution by loads? But how much? Exactly, loads.
The morning will be fine for most after patchy early rain over southern England clears, but there'll be showers in the north and west. They'll be wintry on northern hills. It will be much colder than recently, with a raw wind in the north and east bringing coastal gales. The afternoon will bring a few showers into the Midlands, but there'll be little change elsewhere. The push of clean, cold air from the northern Atlantic means the air pollution index, where 1 means low pollution and 10 means very high, will be low.
The Air Quality Report, sponsored by Philips Air Purifiers.
Now, scientists from Durham University have said that infrared light therapy could potentially help people living with dementia. The study found that the use of the light could benefit people's memory, motor function and also processing skills. Joining us is Dr. Paul Shazet from Durham University. Hello to you, Doctor. Thank you for joining us. This sounds amazing. Tell us about infrared light therapy.
OK, so this is a culmination, I guess, of 20 years research in my lab with a number of people, lots of people involved, actually. It involves a specific wavelength of infrared light, which we've been studying, like I said, for 20 years. It's a very key wavelength, and it penetrates the brain very easily, and you can apply it very easily using a specialised helmet, as on the image here. And it penetrates the brain and elicits lots of biological mechanisms that are very relevant to both ageing and also Alzheimer's disease and dementia.
Looks pretty funky. How does it actually work, and who will benefit from it?
So the idea, well, as I said, it elicits lots of, because aging and Alzheimer's disease is a very complex disease. You need a sort of complex way of treating these. And this light actually elicits lots of different biological effects. It increases blood flow. It increases the battery function within cells. So it keeps cells healthy and viable. It reduces inflammation. It reduces oxidative stress. So it has lots of key mechanisms that you find in aging, also, particularly in Alzheimer's disease. So we've tested this now clinically, which is all important, and in a couple of studies in the UK and in the States. And we've shown that this treatment does improve memory, but in particular memory processes, both in middle-aged individuals who don't have dementia, but also in Alzheimer's disease patients, mild to moderate Alzheimer's disease. It improves quite dramatically, actually, the memory of these individuals. Over a very short period, 8-week treatment, you can elicit perhaps a 20% improvement in memory, which is quite staggering. And actually, it's as far as we can see, we can't see any sort of issues in terms of side effects. So it's a safe, potentially effective treatment. But I need to say, sorry.
Can I just ask you, Professor, is it going to be a preventative treatment as well?
Well, that is a potential, definitely a potential, and we're looking at that seriously. The idea potentially could start using it maybe in middle age and as a preventative mechanism. I mean, the biology would fit that. There is certainly potential for that, as well as, I'm mostly focused on the disease, so Alzheimer's disease in particular, but potentially Parkinson's as well. I'm interested in helping out in the UK, up to 1 million people with Alzheimer's disease. That's my first goal. But yes, as a preventative procedure, it has possibilities. Amazing. But I need to emphasise that we've done very small studies so far, so we need to increase the studies, increase the number of patients, and increase the number of people that so to demonstrate that it would work across the population, if you like.
OK. Professor, we must leave it there, but absolutely fascinating stuff. Brilliant work over the last 2 decades, along with some of your colleagues, as you mentioned, of course, as well. And we look forward to the next steps. Thank you so much for joining us this morning.
No problem. Thank you.
Isn't it great when we speak to very, very clever people who could make a huge difference to so many of us up and down the country and indeed around the world? Also to come, more on that warning from doctors that the government is being woefully negligent by refusing to bring back tougher COVID restrictions ahead of the winter months. We heard from the Health Minister earlier today, and he says at this stage there is spare capacity in the National Health Service. The government is not unduly alarmed, but what should be happening is that more people should be coming forward for their boosters, and they say you can book that online.